and welcome. Today I have with me Mr. Ilesh Khakhkhar, who is the god of entrepreneurship for all of us dermatologists. He's a keynote speaker. He's been a mentor to so many dermatologists, and particularly in the realm of practice management. He's had an experience of about 30 years coaching dermatologists with how to run their practice efficiently, how to build their practice efficiently. And personally, for me, I really feel he really understands the essence of a dermatology practice without making it unethical, which is something that all of us are really very concerned about. So, welcome, Ilesh ji.
Thank you so much, Dr. Tanvi, and it is always pleasure. And yes, thank you for inviting me. Yes.
So, to start with, Ilesh ji, my first extremely difficult question for you would be the word business, when used in the realm of medical practice, always sounds very dirty, right? It has a very businessy feel to it, a very dirty feel to it. Why is that? And does running your practice like a business, does it always mean that it's unethical?
So the first bouncer only. Okay. Now see, let us deconstruct this thing in a simplistic manner. The business has been portrayed, or businessman or an entrepreneur has been portrayed in a wrong way in medical practices. Rather, I would say, what is, entrepreneurship is all about? It is mindset. It is, lifelong game. And business you can call in a simplistic manner, or entrepreneurship you can call in a simplistic manner, is optimizing and maximizing all the resources available to you to create value, and as a byproduct, people earn money. So value needs to be created first by optimizing and maximizing the resources. So it has been, doctor fraternity have been conditioned in a way that we are into noble profession and we are not running our practice as a business. I do agree, being a doctor is the noblest profession. 100%. I cannot imagine me being, without help of doctor. But if you want to do good for people, if you really want to serve society, if you really want to, serve your patients, having that business mindset really works. And it has got nothing to do with ethics. Why? You can, have ethical practices within your practice only. Like if you remember, I teach about strategy of preeminence, where it says that I am I am the most trusted advisor of my patient for lifetime. So, most trusted. Only through your ethical practices only you can become most trusted advisor of my patients for lifetime. So, for lifetime means what? It is your moral obligation that do all the things within the ethical limits only, and to delight patients. So, running your business as a running your practice as a business is not wrong thing. Rather, it should be the ultimate goal.
Absolutely. I remember during COVID, all of these government COVID hospitals also had a hospital management team that would run those hospitals on systems with SOPs, such that your bed usage is maximized. Maximum number of people can be admitted and can use those resources. So that also is practice management, that also is business. And I think that is one thing that we don't learn during our MBBS or our MDs. We just learn how to treat a patient, which is of course our job. But somebody needs to run the practice smoothly. When a patient comes to my practice, he should be greeted at the reception. He's spending a lot of his time. I remember you said this in one talk of yours, that 80 to 90% of the time that a patient spends in my clinic is not with me. It's with my staff. So my staff needs to know how to talk to a patient. My clinic needs to be clean. It needs to be neat. It needs to look pretty. It's important. So all of these things, I think, play a huge role.
Okay, let me give you more aspect of it. See, NGOs all trust, who serve people, who serve society, poor people, underprivileged people, right? do you feel they don't have their own goals? They don't have their own, resources to maximize and optimize. They also run on the principles of entrepreneurship only.
Correct.
So to do good for the society, you need to master all these arts, which unfortunately are not being taught in any of medical colleges and things like that. So that is the main thing. Yes.
Okay, my next question would be, what is running your practice on systems? What are SOPs? What are all of these terms that a lot of, as doctors, we don't know, but are so important?
See, I have observed in my interaction with doctors that when we talk about SOPs or protocols and things like that, most of dermatologists, most of doctors have got their critical procedures protocols set, SOPs set. But SOPs and protocols should be set for each and every aspect of your practice. If your practice is not system based, you cannot scale it because you cannot measure it. So at the end of the day, you will be feeling, like मैं कर तो बहुत रही हूँ लेकिन वो ग्रो नहीं हो रहा है या मैं मतलब आई एम नॉट एबल टू रीच मोर पेशेंट्स टू सर्व देम इन ए बेटर वे एंड थिंग्स लाइक दैट सो लाइक लेट मी टेल यू व्हेन योर टीम opens the clinic, step number 1, 2, 3, when you recruit people, what type of questions you need to ask? The answer to that question represents what type of personality. Would you believe if I tell you that some of the doctors also make the candidate undergo the DISC personality test to find that whether they are the right suitable candidate, they have got enough empathy for their patients or not. So systems needs to be created for each part of your practice. Sorry, I was about to say business, but practice. So, right, but each part of practice, systems are required. And many a times, I have seen many doctors that they have got, like wrong information or wrong perception that they have got all set protocols. My question to you would be, are those protocols being followed in each part of the practice? Number one, every time. Number two, number three, every time a patient visits, they get the similar experience at every touch point, even if the procedure being done by different therapists. But are they getting the exact same result, exact same experience? So if and last but not the least, if tomorrow I come to your practice, I just read your protocol manual and I try to perform the same thing, would I be able to deliver the same thing? If not, then there are leakages in those protocols and the procedures and systems. So that's the thing.
Absolutely.
And whatever things are being repeated again and again, for every such thing you need to have systems. Yes.
I personally feel the same thing happened. I was relying on my staff to figure out on their own how to answer the phone call. And I thought that's such an obvious thing. Who doesn't know how to answer a phone call? Who doesn't know that, when you pick up the phone, you should say, hello, Derma MD Clinics. How do they not know that? But then one day I said, okay, I need to sit down and write a script for this. I gave them a script, and now each of my front desk executives answers the phone call in the exact same way. Each of my therapists now greet the patient in the exact same way, take them into the procedure room, perform the procedure in the exact same way, ask them if, ask the patient for feedback in the exact same way. And I think that makes a huge, huge difference to our practice.
Wonderful. Here I would like to add 2 points. One is, for we can say that in India, 85% of the practices are small to medium practices. So there also you need to evaluate those protocols and those things which you already given to your team members every 3 months.
Yes.
To see that whether they are still producing the same results or not. That is number one. On a large organization who have got thousands of employees, it can be done in a year or bi-yearly. But in a small to medium practices, it should be done quarterly. That is number one. And point number two, people will make their own rules in the absence of rules clearly defined.
Absolutely.
So what mistake we make, as an entrepreneur usually, that we don't. ये तो कॉमन सेंस की बात है इलेश जी, वो तो उनको पता चलेगा ना. It is common sense, but it is like saying I met a beautiful woman outside. Now, the definition of beautiful woman would be different in everybody's mind because according to their preferences, their life, and their circumstances, they would define. So, same way, you need to set the rules, and you need to define them that what exactly the best outcome would look like. And last but not the least, always provide the precise instruction and clarify their whys. Like, let me give you one more analogy. I tell you, ma'am, I keep my mobile in the pocket. So now there, different pockets are there. One here, one in my back pocket. So that is number one. Number two, in back pocket also you clarify. Let's say I told my team members that you need to keep your mobile in back pocket. Then back pocket, this way, this way, this way, this way. There are various ways. So if you don't articulate all these things very precisely, they would interpret themselves, and it would not be in according to the value system of your clinic and the way you want to serve your patients. So all aspects should be precisely articulated and communicated more frequently. Number 2 point of the same thing is you need to provide why. Say, for example, you train your team members, you always keep your mobile in back pocket and this way. So why this way? Why not this way? So that also you need to articulate and make them understand. Because I get a lot of feedback from dermatologists that you said all the protocols and all the things, but our team are not following what to do. So have you done that thing? Articulating precisely, number one. Number two, have you already cleared their why you want this to happen this way? Have you given them the picture that what best outcome would look like? So there are small things which makes a huge difference when it comes to patient experience.
The next question I'd like to ask you, Ileshji, is dermatology as a branch particularly has evolved drastically. And we are now not just treating fungal infections. We are also performing medifacials, and we are pretty much now bordering gradually into more of an experiential sort of practice. So we need the patient to feel like this is a holistic, elevated experience for the patient. So how exactly can we go about doing that?
See, ma'am, here, it is an experience economy. And there also some misconceptions are there that you will be seeing that XYZ in my vicinity, other dermatologists or other non-dermatologists who are practicing dermatology are your competition. No. See, patients would always evaluate the things they are getting exposed to. Like when Amazon or when this e-commerce company are planning to deliver Blinkit, they are delivering the things within 20 minutes. So they have that thing in mind that the definition of speed is being changed. Number one. Number two, it is called halo effect. Halo effect means what? That the initial impression of the practice or how they perceive your clinic or you or your team members creates a lot of right perception about how they experience as a patient. So that's why now see, dermatology clinics are being compared with
Spas.
See, as a dermatologist, you would feel offended. No, Ilesh, we are dermatologists only, this and that. But it is not up to you.
Absolutely.
Patients are comparing.
Absolutely.
It is not in your control.
With
with all due respect to all dermatologists, I do believe that you are the authentic person to treat skin and hair ailments. However, it is not in our control to stop patients to compare you with spas or compare you with 5-star properties and things like that. You got the idea. So it is an overall experience things. And who are the target audience for derma clinics? Say, for example, right now, we are not talking about clinical dermatology anymore, but we are talking about, procedures and cosmetic dermatology. So they are elite group of people. They go for best of the best things and they want to get that experience also. So that's why experience comes into the picture.
One more issue, Ileshji, is there's a lot of people in the dermatology world who are not dermatologists. Not just, it starts off with dentists and just people without degrees. There are also technicians who start their clinics, there are lawyers who have started their clinics, there are 10th standard pass kids who have started their clinics, and they are performing everything, lasers and haifus and whatnot. So, what do you have to say about that?
See, again, it comes, what is the difference? Just see. Number one is unity and collectivity. Like they know that you are the authentic figure for skin and hair. So they have sharpened their entrepreneurial skills. They have exploited experience economy. It is now high time for all the dermatologists, with due respect, to explore all those things, not because of the other people are doing that thing, but just let me tell you one thing. Your practice is a part of your entire life. Am I right? And your scientific knowledge, academic knowledge is a part of your entire practice. So when you tell about practice management or managing thriving practice or things like that, it consists of so many other aspects which so-called influencers or non-qualified dermatologists or whatsoever you call, they have exploited that thing. So only one thing, if you change your mindset that yes, I need to thrive in my practice just to do good for my patients, not to earn money. Earning money is a byproduct, not to earn money, but to serve more people. Just that shift in mindset, and you can just imagine that what you can do and how you can create such experiences, and you can attract more and more number of people to your practice and things like that.
That was a great perspective, Ilesh ji. Most of the times we just sit getting so frustrated about ye kaise kar rahe, how are they practicing, and we're just getting frustrated for no reason. We can just sit and elevate our practices and make our practices better. We have the degree, and if we provide the experience, I don't think we need to look at anybody else in the market.
Yeah, you forgot, ma'am, what I said. Unity and collectivity. Now see, whenever somebody Googles about something, some misinformation will pop out. Why can't we collectively make so much of content by dermatologists only and publish it so regularly, so any person across the country Google it out something, and dermatologist video would only pop up with authentic advice? Why don't we only encourage patients visit this AAD site or IADA site where proper information has been given? But we don't do that thing, and collective efforts is the key.
Absolutely. I really feel, there's a lot of resistance within the dermat community about dermatologists being on social media. I'm on social media, and I really feel we need to be on social media. We need to be there, because if we are not there, there's only influencers who don't know anything about skin talking about it. Why should qualified medical personnel not be able to put out relevant medical information? I'm not talking about give out prescriptions on social media, but give out the correct medical information. I think it's very important.
See, as I told you, it is experiential economy. Now it is, education economy too. Why can't we work collectively to educate patients, not about the prescription or diagnosis, but what are the things, what are the, prognosis, or what are the, minus points of the getting treated by, over the counter products or so-called influencers, or following just Instagram stories and getting treated that way. Why can't we collectively do that thing? So educational content is the right word, and that should be created collectively, and that should be spread also.
Okay, on that note, I'd also like to ask you, there are a lot of dermatologists don't want to be on social media, or they want to be on social media, but they don't want to embarrass themselves. They don't want to dance on social media. So I want to just ask you, is it mandatory for every dermatologist to be on social media? Because it feels like that right now.
To answer your question precisely, yes, it is mandatory to be online, because if you take a survey, 95% of the patients coming to you, they Google about you, they search online on Facebook, Insta, YouTube, whatsoever. So if you are not there online, you do not exist. This is as simple as that. That being said, why doctors are not doing that thing? because they don't know there are other ways and solutions to that. Number one reason, they don't like dancing. You don't need to dance. You don't need to do all those things. See, I'm not criticizing the people who are doing. That is also fine. If see at the end of the day, what makes you happy, you should do that thing. If they are comfortable, that makes them happy, then it's fine. I don't have any problem with that. But your social media presence is mandatory. So there are ways to do that thing. So without dancing, even some people would be camera shy, say for example. So then also there are ways to do that thing, create content, right? So like I have published one book, camera shy or social media shy. Then there I have given 30 ways how you can boost your social media even without you being present on social media. Like how to do so automation and AI and so many things are there. Different types of contents are there. Videos also can be created without your face.
Yes.
So many things, but that you need to learn and master.
Yes. Or just written posts, carousel posts,
Yeah.
just
Simple.
pure content. Absolutely.
Right.
And I feel
Now,
it really
one more thing. So that is number one. Number two is time is a constraint. अरे सर मुझे टाइम नहीं मिलता है कंटेंट क्रिएट करने के लिए. You don't need to invest that. Now with the help of AI, mind you again when I say AI is the reference point to create the content, not the entire GPT. You can copy paste. No, not that way. Your content should be your own only. But with the help of AI, you can generate lot many ideas and lot many content, and you can iterate. So earlier, where you used to have 1 hour for one post, now you can do that thing, the same thing in 10 minutes. Then the third concern is what Hey, sir, I tried a lot, but nobody was watching my reels or I was not getting likes. Then your primary purpose is lost. Your primary social media should not be used to get the likes or views. That's fine. It is in a way outlet, and it is in a way, nowadays many people they don't go for like, but they read. So your reach is enough. That's fine. So don't measure your social media presence with your whether it is helping you to increase the followers or like and things like that. So
And
do it for yourself.
correct. I've also noticed a lot of patients who come, they're going to come to you anyway, but they just want to see what does my doctor look like? What does my doctor talk like? They just want to get a feel of the doctor before actually going in to
That
the
is also
clinic,
true. That
which
is
is
also true.
fine. Why not provide that experience for your patients before they come to you? Works absolutely.
And that also helps you building your credibility and portray you as an authority.
Absolutely, absolutely. In fact, I had patients who used to come into my clinic for fungal infections, and one day they saw a video I had made talking about pigmentation here, melasma. And my patient's mother had melasma, and then they realized that, oh my god, my mom could be treated. And then they came to my clinic and I treated her melasma. So it just really helps with creating awareness, even for your own patients. So even if your 10 patients are watching your videos, it's great. Why not?
Really wonderful. And that brings me to my earlier point. Treat your practice as a business. Why? Because if you see, conduct a blind survey, how many of your patients are knowing each service you provide or each thing you could do, you are able to do that thing or cure that thing. Many of them, oh, आप हेल्थ ट्रांसफर भी करते हो, मालूम ही नहीं है. So if you have that entrepreneur's mindset, you would always be consistently thinking of optimizing and maximizing all resources and doing all in-house publicity and different fancy graphics and all these things. You would be doing that thing, patient awareness brochure and all these things you would be doing. Otherwise, just simple.
The next question I'd like to ask you is what about using softwares and technologies in our practice? Again, as doctors, we are all very technologically terrible. So, what about the kind of different softwares and everything that we can use?
With apology, I would like to correct you. As a doctor, you are very well aware about the technology and all these things. But again, your brains have been conditioned to think in terms of laser technology and all those things only. Tell me how many dermatologists are actively using AI? How many dermatologists are making use of other technology like CRM or ERP or WhatsApp integration also? How many dermatologists are doing? You would be observing that the moment you buy something from some reputed store, you would get WhatsApp message. on your WhatsApp, thanking you or something like that. Why can't that be copied? So technology would save a lot of your time. And for the people, they are not camera friendly and all these things, you may be surprised to know that what AI can do for you. Like if I tell you, through Chat GPT, you can create SOPs of all your procedures. Were you aware of that thing? But ChatGPT will not give you exact accurate thing.
Of course.
You needed to iterate that thing. You needed to make corrections into that. But the thing which you were only 3 years back only you are thinking, अरे इलेश जी SOP बनाना है ये कैसे करूँ मैं क्या करूँ, and you used to invest lot many days to create and define just one SOP. Now it can be done in just 1 hour. So technology, obviously, all of the dermatologists or all of the doctors should be embracing that thing, because coming age is that only. But being a doctor, you are very well versed with that. However, technology when it comes to academics, not other all the technologies, right?
I'm glad
But it is high time.
I'm glad I've married my husband. He figures all of the tech bits for me. So we do have a WhatsApp automated message that goes out.
Oh, you have already
patients
done.
and all of that.
Oh,
We have a
wonderful,
CRM.
wonderful.
But yeah, I think
Now share your experience about that. How your patients are responding? Good.
patients are very happy. In
Yeah,
fact,
that's what.
the moment I realized, I used to write a follow-up date on my prescription pad. Of course, we had a software for that as well. So prescription, follow-up date would come on the prescription. But I've had a few patients who come calling me up and saying, "What is this? Why didn't you give me a reminder call?" And I said, "Why do I need to give you a reminder call? It's your appointment. Of course, you have to turn up." And I thought it was so absurd. But then I realized the world has moved in that manner that people now expect these things. They expect, how do you not, how does my doctor not have a software that is going to send me a reminder message? And patients have that feeling. And then my husband did implement a whole software, and patients are so happy with it. So happy with it. Just a simple thing
These
like a
are the
reminder.
small things which can create a wow factor for patients.
Next question, Ileshji, is a more personal question for you. Is how did you get into this field of practice management? How did you get into this entire realm?
Frankly speaking, it was not a planned journey, man. See, I own a commerce degree, so I belong to commerce as a background. And from the beginning only, my entrepreneurship mindset is, like, so I used to suggest my near and dear doctors, basically from Gujarat only, that sir, why can't we do it this way? How to optimize this thing? How to do this, deliver this thing? And they were getting good results. So then, word of mouth, the other doctor also started approaching me. So it was not a pre-planned or strategically moved. That is number one. But there was a time when I came to know that okay, doctors are not being exposed to these things and doctors are not being educated about this thing. So let me, cultivate that area of my expertise. So that way, then I shifted my entire focus to practice management, and here it is.
Lovely. That's so inspiring. Okay, one more question that I am personally very curious about is that you're doing 10,000 things. You have such a big company. You have so much staff. You have these keynote speeches that you give. You organize all of these mentorship programs. I'm so curious. How do you manage your time? Because that is something I personally massively struggle with. How do you strike a work-life balance and time management? Basically, how do you go about that?
It is perception, ma'am. I don't do anything. Really.
Well,
there was a request from few of the dermatologists that, for my key team people, I had that thing 48 hours with Ilesh Khakhkhar, where they would be shadowing me. If you observe that thing, I don't do anything. My main work is to get the work done. So I don't do, I am master of delegate and time management. That means I would say plenty of things no rather than saying yes. That is number one. Build amazing team. Number two, and optimize and maximize your time. Like my screen time, you would be surprised to know my team's screen time on my mobile is around 5 to 6 hours a day. But what I do is absolutely different than what people would be doing.
no net scrolling on Instagram.
Right. So that way, so lot of things would be there. Team building, delegation, and effective time is learning the art of saying no to so many things which doesn't bring you forward. when I say we doesn't bring you forward, it is not selfishness, but it is, your ultimate mission and vision.
That's amazing. That's genuinely very amazing. And learning to say no to social commitments is something that I really need to learn from you. Okay, the next thing I want to understand is about team building, what you mentioned. Uh, managing staff, managing a big team, managing people is something that a lot of people struggle with doing. We get super frustrated that why is my staff not listening to me? Why am I not being able to retain my staff? How do you go about that? Any tips on that?
See, ma'am, whatever the questions and challenges are there now, the foundation of that is many misconception. What do I mean by that? Like whether to treat your practice as a business. So misconception are about business. Should I be on social media? Misconception about the social media because it would be time taking or I need to dance like that. So here also the misconception is what? Misconception is that people work for money. Obviously, money is a part of their overall package. But the thing is what we consider ourselves to be very poor paymaster or very good paymaster, but still people are not working with us or staying with us. Monetary aspect is just one portion of the theme. Rest, so many things are there that whether they feel fulfilled, whether you keep telling stories, whether you are a genuine person while dealing with them, whether you have got empathy. See, I've seen many doctors, they have got empathy for patients,
But not for the staff.
but not the staff. If you can't delight your staff, team members, they won't delight your patients. In one of my workshops, Dharmapunar, I still remember, I asked people, okay, you needed to talk to your new onboarded team members at least for a week, 5 days every day. Oh, lazy, we don't get time. Then I asked the same doctor that how much you give time to your patients. So the average 15 minutes will be there. And what is your consultation charge? Doctor replied that it is around 600. For 600 rupees, you give patients 15 minutes. 5 minutes you can't spare because that 5 minutes would impact the entire experience of all your patients. So those are intangible things. The staff is intangible things. That's why we don't invest. While patients are tangible. So there is a difference. I do not say that at the cost of patients, both should go hand in hand. But my dear friends, my request to you is if you can't delight your team members, you can't delight your patients. So always, keep them motivated, give them challenge. People love challenge. Many of doctors, are afraid to challenge it. There is a kahawat in our Hindi, खिलाना सोने का नेवाला रखना तलवार की नोक पे. And I came across that radical candor. That means care personally, but challenge them also. So care personally, but challenge them also. There should be a right balance between the two.
And so, what about your work-life balance? That yes, of course, you do optimize your teams well, and you optimize your time well. But what about like home time, hobbies? How do you make time for everything else?
See, my previous two questions answered this question also. That if you develop, amazing team, become master of the art of delegation. That is number two, and start mastering saying no. These three things can help you prioritize your things, and you can keep your remaining thing. You can keep your for your family. I am really blessed to have such a family who cooperate with me in all the things, whatever I want to pursue, whatever makes me happy. So I'm feeling blessed. And obviously, one little secret I would like to share. When my wife goes for sleep, then I do start my working. So that way it is.
But when do you sleep?
And you would be surprised to know out of in a week I go to office for 2 to 3 days only. Rest of the time I will be doing in my home office, so where nobody would disturb me and nothing can be done. So that way it is.
Yes, that's huge. But I think it takes a lot of planning to plan your day, to plan your week, to plan your life, to be able to execute things
If you
that
see
changes
if you
happen.
see my mobile, in my mobile you can't see the icons of the app because I'm using one app which hides all the icons.
Ah, brilliant.
So, yeah.
You need to share that with me. Okay, thank you so much, sir, for being here. It was a privilege having you here, and I really hope this podcast would, help add some value to all the dermatologists who are watching this and would be able to manage their practices a little better. Thank you, sir.
It was honor. Thank you. Thank you.